Hello, I'm Dr. Elliott, Antman, President of the American Heart Association. I'm here with former Vice President of the United States, Dick Cheney, and his cardiologist, Dr. Jonathan Reiner. We've just completed a panel discussion here at Scientific Sessions in Chicago about living with heart failure. Mr. Cheney and Dr. Reiner, thank you for staying a few minutes for an extended discussion. Perhaps I could begin by asking you what the symptoms of heart failure were like when you first perceived them and how you knew something was wrong at that point.
There was a period of time towards the end of my time as vice president when I guess I had a couple of instances of atrial fibrillation.
That's right.
There were days when it was more difficult to walk up the stairs. When I noticed that I wasn't as strong as I had been, it wasn't sort of any one particular dramatic thing that I think about. But you know, by then I'd lived with heart disease for 30-some years, and had reason to expect that sooner or later I would reach that point when it would begin to affect my physical abilities.
And what did you hear from the Vice President that made you suspect that heart failure might be an issue that you had to care for?
I think, well, just that things are becoming a little bit more difficult. We had the sort of unique benefit of having a member of the White House medical unit with him all the time. So it was basically akin to having, you know, a super highly trained professional with one of your heart failure patients 24/7. So, you know, any small change in his status was, you know, could be immediately communicated to us, and I think that was incredibly helpful, and I think that really did aid in the Vice President's longevity. You know, we never saw him, you know, 20 pounds overweight with tremendous edema. That just never happened because there was always somebody with him.
Thank you. I mentioned to you earlier that the American Heart Association, which is now in our 90th year of existence, for many, many years had as our tagline, learn and live.
Mm-hmm.
And more recently, just this summer, we've switched that to life is why. And let me explain a little bit about that. So we might ask ourselves here at the American Heart Association why we do what we do. For example, Dr. Reiner might think about why he does what he does every day. And our answer is so our patients can live longer, healthier lives and can enjoy more of the precious moments that are so dear to them. So if I were to ask you, what is your why? What are the precious moments that you really look forward to every day now because you're the beneficiary of what the medical profession has provided for you?
Well, there's just the sense that every day is a new day, that it's special, because there was a time when I thought I'd reached the end of my days and didn't anticipate any new days. That was about 17 months after I left the White House, and I reached, I guess, end-stage heart failure, and contemplating the possibility of imminent death. And it was it was not a time when I was unduly concerned. It was not frightening. I was at peace. But I also thought I was at the end of my days, and now I find myself in a situation where that was over 3 years ago. I've had the tremendous gift of those intervening years to spend time with family, my grandchildren, my wife. Done some important and amazing things during that period of time, as I say, using days that I never expected to see.
Wonderful. Dr. Reiner, think about that from your perspective. So life is why. We ask people, what's your why? So as a physician, and then as a physician caring for the Vice President, what did you learn from this that makes you answer, what's your why?
Well, for this particular patient, there's a photograph that I found, which was taken of, you know, probably less than a year after the Vice President's transplant. And for me, it completely encompasses the why. And it's a picture taken in, I think, a kindergarten class. And the Vice President is being interviewed, and his interviewer is his grandson, Richard. and that's the why. So that his grandson Richard can get to know his grandfather, and his grandfather can spend time with his grandchildren. So that's the why.
Wonderful to hear, very inspiring, and in fact, one of my whys on the personal side is my 5 grandchildren. You both talked about that.
I have 7.
Well, all right.
Okay.
You got a head start there. Now, we had a bit of a conversation about the evolution of the doctor-patient relationship, and we've got some more time to talk about that. So you were involved in your medical care from the perspective of the patient with respect to decision-making. So could you expand on the answer that you gave us a few moments ago, and then Dr. Reiner, if you could as well. So what would you say to the patients who are so used to that era where the doctor tells them what to do? We're in a different era now where we really ask the patient to become more involved in this, we call it shared decision-making. And there's so many options that are available to patients. We really want to know what they would like. So what's your advice to those patients?
Well, ask questions. If you've got somebody who doesn't want to answer the questions, you've probably got the wrong doc. I've always benefited from the fact that John Reiner's been very open, very knowledgeable, but very good at sort of presenting me with all the relevant facts. I want to know, why we're going to do what we're going to do or thinking about doing. I do like to make the decisions myself, and I do that very much, obviously, with his assistance. So I just think it's important in the sense that I wanted to. Partly it's a matter of wanting to feel like I'm in control of the situation. Things happen to you. You're sick. You have a heart attack, and so forth. But there are things you can do about that. And I've been able, because of the wonders of modern medicine, obviously, to weather more than, since 1978, that first heart attack, to weather, as some people have suggested, virtually everything that can happen to a heart patient happened to me. I was once invited together with John to go to the Cleveland Clinic, and they were having a conference on innovation in cardiology. This was before the transplant, when I was living on the pump. And they said, look, they had the suppliers coming, the doctors coming, but they needed a patient. And they'd done some research and figured out that I'd had nearly everything done to you that you could do to a heart patient. So we went up and spent the day at the Cleveland Clinic. That was very educational from my standpoint. But it also said a lot about the tremendous advances that we've made in medicine, and I've been the great beneficiary of that.
Dr. Reiner, when we were training, the conversation wasn't the way it is today, where you're going to encounter patients and they want to be involved in their decision-making about their health care, but we're doing more of that, and you had a very special responsibility here. Could you talk about what you went through as a physician with this relationship with the vice president?
I learned a lot from the patient, and I think I learn a lot from all of the patients that I care for. I learned how important it is to have trust, and the trust is a two-way street. Trust is earned, but it's critically important. I've always thought that it's the physician's responsibility to inform the patient so that they can make the ultimate decision, but it is really the physician's responsibility to make the recommendation, not to give the patient a choice, but to give them your recommendation, tell them why, and enable them to understand why you're doing this. Never, trust me, I'm the doc, or have you been to med school? It always, it's a partnership. And this patient is really no different. The extraordinary aspect of this patient is that his care became so complicated. He was the most clinically complicated patient I've ever cared for over a very long period of time. And that patient happened to also be Dick Cheney. So it was this extraordinary sort of nexus of complexity over many, many years, and in somebody who was the Vice President of the United States during a time of war. So I learned a lot about I learned a lot about myself. I learned a lot about my colleagues. I learned about the power of American medicine, the power of optimism, and it's really a remarkable story. The vice president's story doesn't just reflect the natural history of ischemic heart disease, which it really does so amazingly, but it also reflects the triumph of innovation and research and the tenacity of investigators and innovators who for decades refused to believe that what didn't exist was impossible. And that's really, I think, the story of American medicine and certainly cardiovascular medicine.
But I'm going to ask you to send a message to the folks who are working so hard every day at the American Heart Association. Our staff, I mentioned to you, it's our 90th year. Just putting on this meeting is a tour de force, and everybody's pulling in the same direction. It's hard work for those individuals, and seeing how well you're doing is so inspirational. What do you want to say to the folks who worked hard who work hard at the American Heart Association every day?
Thank you. I mean, it's an organization that's done a great deal to advance the cause of heart medicine, treatments, and so forth. I feel an obligation to try to help when I can, when I'm asked to participate in events like this. For me, it's partly a matter of payback, that all of those developments that have saved my life didn't exist when I had that first heart attack. And I think a lot of it's been due to the hard work of the association, the support for research, the development of programs of awareness and so forth that have contributed so much to the reduction in the incidence of death from heart disease, and I'm one of the prime benefactors of that.
Very inspiring words, thank you. And Dr. Reiner, you and I have been on programs and meetings just like this, and you've seen so many things that have been made available now in American medicine. But we're also living in a digital world where some people say I can get the news about the latest trials by looking at the internet. But here we are in Chicago with about 20,000 individuals at this meeting. There's a lot of networking and face-to-face interaction, which is hard to replicate when you look at the internet. Can you speak about that face-to-face interaction and what it means to you?
Oh, absolutely. First of all, there's a palpable excitement. I was in the room yesterday as the DAPT data was presented, and it's provocative data. And there's a difference to checking a Twitter feed about the data, although I was tweeting about it as I was sitting in the room, and being there personally, and then being able to talk to colleagues about it and contextualize it afterwards. So I think, I hope these big, hard to put on sessions never go away, because you can replicate them by 140 character, synopsis. And seeing the kind of panel that helped to interpret the data yesterday, that's irreplaceable.